Yusuf, do you know why Sophie, your woman, is losing pregnancies every single day? Now worry no more. This is the right place where you are supposed to be. Please have a seat and we'll discuss the science. The reason as to why she is losing pregnancies consecutively, or why she lost 1 or 2 or 3 last time, this could be one of the reasons as to why it is happening. First of all, let us discuss the science. Genetic abnormalities. Usually, when there is a mixing up of chromosomes or genes, there could be something wrong going on. If something goes wrong when the male and when an egg and the sperm come together, if that mixing happens poorly, chances of getting an abnormal fetus or abnormal child inside increase. This therefore also increases the chances of losing pregnancy. As a matter of fact, Mr. Yusuf, we have other things like immunology. Sometimes the mother herself reacts against the baby inside, and then in the end the baby is lost. As a matter of fact, we also have autoimmune disorders which can result into loss of the baby. We have abnormalities of the uterus. For example, you could have fibroids or adhesions or anatomical malformations of the uterus, whereby the uterus is not assuming the normal size of how it is supposed to be. At the end, the baby, it cannot carry the baby to term. Secondly, the cervix itself could be incompetent or sufficient enough to support the baby or the pregnancy up to full term. As a matter of fact, we also have environmental causes. We have things like smoking. In case you are a smoker, Mr. Yusuf, remember that time when your woman used to smoke, take alcohol, and the other sorts of things. As a matter of fact, remember, she also worked in an industry full of pollution and etc. So that could be also a reason as why she keeps on losing pregnancies. Nutrition itself. For example, poor nutrition can also, remember, what the mother is taking in is what the baby is feeding on. That could also be one of the reasons or the factors contributing to why she is continuously losing pregnancies. We have maternal illnesses. I would like you take her to the health facility to find out. For example, if we have heart diseases, kidney diseases, or any metabolic disorder, it could contribute, or it could be one of the reasons as to why she keeps losing pregnancy. You get my point? It could be one of the reasons she keeps losing pregnancy. So, not forgetting, I remember last time we talked about some other important thing, which is infection, if you can remember. You see, these normal infections, viral infections, bacterial infections, could be fungal infections. As a matter of fact, as far as I'm concerned, I've witnessed myself when people are losing babies just because of infections. Things like toxoplasma, things like rubella, you get, can result into, syphilis itself can result into still loss of pregnancy. You get my point? So as a matter of fact, all those things in a combination, when you come to me, I got to evaluate and take history. I understand where you fall. Because after understanding where you fall, it gives me a clue where to start from to either advise or execute plan of treatment. As you know, interventions, of course, interventions are different. Anyway, medical could be surgical, sometimes could be just counseling and talking about a few things here and there. For example, smokers, cease, minimize, alcohol, minimize or cease. You get it? So it depends. That's why I say it could, the advice or you get from health profession could be changing lifestyle or surgical intervention or this normal medical intervention. So Mr. Yusuf, stop blaming that lady because she's not getting pregnant or she's losing babies. Carry her, take her to the doctor or bring her to me. I'm just here in Ginger.